Hand hygiene is considered one of the most important ways to reduce the transmission of infections. It's important that the correct facilities are available and the correct technique is used. Hand wash basins in social care settings should have the following standards as a bare minimum. Used for hand washing only and not used for the disposal of other liquids. No plug or chain. Must be in a good state of repair. Wall-mounted liquid soap and paper towel dispenser, and laminated instructional hand washing poster. Hands should be washed with liquid soap and water when hands are visibly soiled or dirty, contaminated with bodily fluids including blood and saliva, and looking after service users who have diarrhea and vomiting illness or gastrointestinal infection, especially if they have a Clostridium difficile infection, as hand gel will not kill the spores. And before putting on gloves and after removing gloves. Before performing hand hygiene, expose forearms. Forearms should be bare below the elbow. If disposable oversleeves are worn, following a risk assessment, these must be removed before hand washing and then replaced with a new pair. A simple plain metal commitment or wedding band can be worn, but it should be removed or moved up the finger during hand washing. Any religious wristwear should be moved up the forearm during hand hygiene and secured when carrying out service user care activities. Fingernails should be short, clean and natural. Nail products such as nail varnish or artificial gel or nails should not be worn. Any cuts or abrasions should be covered with a waterproof dressing. Wet hands with clean, running, cold or warm water. Apply liquid soap. Rub hands palm to palm. Rub the back of each hand with fingers interlaced. Rub palms together with fingers interlaced. Rub with back of fingers to the opposing palms. Rub each thumb clasped in opposite hands. Rub the tips of fingers. Rinse with water. Thoroughly dry your hands with paper towels. Dry one hand at a time. Dry from the tips of the fingers down to the wrist and then discard the paper towel into the bin. Use a new paper towel for the other hand and repeat. Your hands are now clean.